Dr. Brittany Ellis is an emergency physician and a specialist in geriatric emergency medicine, and she's cut her own work hours by half due to burnout and stress. We've reached her in Saskatoon. Doctor, thank you very much for joining us. What do you make of this top line number, the 1 in 10 doctors leaving the emergency department because of burnout?
I mean, I understand it. I appreciate it. I'm glad to see some numbers coming to support the context that we've been knowing in emergency departments across Canada for many, many years now. It's heartbreaking, but hopefully with numbers now, we can start to do something about it.
And I know you're willing to talk a little bit about your personal situation, which is experiencing burnout and reducing your hours. Tell us about that.
Yeah, I've been an emergency physician now for just over 7 years, and was beginning to see my work directly impacting my wellness. I have a young family, I have a lot on the go, and it was primarily affecting me in my sleep and my ability to have space for my family and to be the mother, the wife, the person that I was and I aspire to be, but was really bringing home a lot of weight on my shoulders, and didn't feel like I was doing what I could.
So explain that maybe to us a little bit, because you chose a role that inherently is incredibly stressful. I think most of us look at docs in Emerge and just think, how can they possibly do that job? So you went in there choosing that as a specialty. What was it that went beyond your expectations that led to burnout?
Yeah, I still can say, even with burnout, I love being an emergency physician. It took me 15 years to get here, and I don't regret a step of it. But what is really impacting me is feeling like I can't do the job that I was trained to do, and to know as a geriatric specialist just some of the risk and harm that care in our departments across the country are causing. We see patients who are 80, 90 years old in stretchers and hallways for days. We see them being cared for in hard chairs, in waiting rooms. We're trying to do our best. We've adjusted our care spaces. We've adjusted our policies. We've adjusted the entire way we practice medicine in some instances. And the patients keep coming, and the services, there's nowhere for them to go, I guess, in many ways. So our departments are full of admitted patients. Sometimes there's 1, 2, 3 beds out of 40 or 50 for me to see patients in. And that's a dangerous situation. That's a stressful situation. And it also puts a big burden on the nurses and the physicians in our emergency departments across the country.
This is a story that we'll continue to focus on, whether it's on this program or Cross Country Checkup, the radio program I work on. But there's a sameness to these stories that I'm sure people watching, whether they're doctors or not, finds frustrating. So, I mean, where do we go from here?
Yeah, I think that frustration is one of the big things and one of the reasons we're losing people. I think we'd like to see in CAPE, our national organization, would like to see some increased accountability and transparency. And what we'd really like to see across the country is better data, and using that data to both drive decision making and how funding is allocated. So, for example, we know we need more long-term care, acute care beds, but we also need more community care. We need patients to be able to go from the emergency department into the acute care setting and then back home again in a timely and efficient manner. And until we understand the complexity of these problems, and until we even look at assigning funding and from a federal to provincial level in line with some of this information, then we're not really going anywhere. I feel like we're really putting resources into the wrong place, and we need to look at it with a more data-informed decision-making process.
Well, I appreciate you talking to us about this. As I say, we will remain committed to this story, and I hope we get a chance to speak with you in the future. Dr. Brittany Ellis, a Emerge physician in Saskatoon, thank you very much.
Thank you.